but I'm going to talk to you about what the health service is, or at least what you think it is, because I'm not sure I have a clear answer to the question, and I'd like to know what you think, because there's been a lot of argy-bargy about what the health service is, about whether it's to be abolished, whether it's to be privatised, about whether the government wants to keep it, about whether we can afford it. All big questions that have arisen before. We had healthcare in Manchester before we had a National Health Service. This actually comes from Liverpool. I was in Liverpool last week. This is a plaque showing the plaque for Dr. Drysdale's memorial bed, endowed by public subscription in 1893. Manchester Royal Infirmary was a voluntary charitable hospital. You didn't have to pay, or most people didn't have to pay, to be treated there. The way it worked, fundamentally, was that the doctors made their money by charging students who would then learn to be doctors in their turn, and then they would go and charge rich people. Rich people did not, in general, go to the hospital. The doctor came to them, unless it was about surgery. And if you look at Manchester Royal Infirmary, there is still on the wall outside a rather nice plaque which thanks the students of Manchester in about 1927, I think, for raising £100,000 by means of flag days and the like. The Labour Party likes to claim credit for inventing the National Health Service in 1948, but actually, as Bernard will remember, the National Health Service started in 1912 with a system of health insurance, and this is an advert. This was the Lloyd George Liberal government of 1912 that set up the National Insurance System, where, as this little ticket says, the male worker paid 4p a week, the employer pays 3p, the state pays 2p, and then during your illness, during your illness you get 10 bob a week for 26 weeks, and then if you're still incapable of work you get 5 shillings a week until you're 70, and you get a free doctor and medicine and a 30 shillings maternity grant and sanatorium benefits. That's from 1912. Now, of course, in 1912, what a doctor could do for you was pretty limited, really. There were no drugs that worked, really. There were no antibiotics. The first use of penicillin on a human being was not till 1942. There was some surgery and there were beds. Lots of beds. Because what was on offer mostly was rest and offering you a chance to recuperate. Ever since, certainly ever since 1948, we've been reducing the numbers of beds in hospital because that's not the way we do it anymore. We now have treatments that work. The big merit, actually, of the national insurance system in 1912 was not the medicine. It was the money. It was the 10 bob a week. Because if you were too ill to work and you didn't have anybody to look after you, you could starve to death. And people did. Some people say that the NHS is the British national religion. If you look on it as a religion, then the big teaching hospitals are the cathedrals. They swallow all the money. What you get out in the sticks are little chapels with no money. In 1939, the hospitals were effectively taken over by the government. Not because they were socialists, it was a conservative government. They took over the hospitals because they thought all the beds would be needed for casualties in the war. So the Royal Infirmary, Wythenshawe, Withington, Park Hospital, they're all effectively run by the government from 1939. There weren't actually anything like the scale of casualties that were anticipated. There was far less need for beds than there had been in the First World War, and certainly in the Second World War. But the running of the hospitals had already been taken over, and that actually made setting up the National Health Service much easier, because they had a better idea of what there was. And there was a very complicated picture of provision, because there were the voluntary hospitals, like Manchester Royal. There were the local authority hospitals, like Withington Hospital, and Park, I imagine, was also owned and run by the local council. There were sanatoriums or isolation hospitals, which is what Wythenshawe Hospital was, and Bagley and Monsall. And the fundamental assumption of the isolation hospitals was to keep people who are infectious away from the rest of us. And at the same time, and you don't hear so much about this, there were enormous psychiatric hospitals out in the country. Typically, Calderstones, I think, was the biggest one here, but there were some in North Manchester and Prestwich. And often they had thousands of people who stayed there mostly for life. And many of them were people who we would now call learning difficulties. At the same time, there was a network of what are called approved societies, trade unions, burial clubs and the like, and they could employ doctors. There was a very messy mixture of provision. And I'm afraid I don't know that much about how it was in Manchester in any detail. What I'm presenting to you really is a national picture, because what happened in Manchester was part of a bigger picture. This is a cartoon from 1942, the Beveridge Report. This is that's Mr. Beveridge, actually, down there. A small figure with his sword, attacking the 5 giants: want, ignorance, disease, squalor, and idleness, who's lying down, as might be expected. Of course, the Beveridge Report concentrated really on setting up social security. He said, and we need a free National Health Service. But Beveridge didn't explain in great detail what this free National Health Service would look like. And then there were huge debates about how it should be organised. And one of the fundamental debates, which is still alive now, was, is this going to be run all centrally by the government, or is it going to be run by the local councils? This is a rather nice little picture of the National Health Service showing some surgeons about to operate on Bernard or somebody like that in 1948, March 1948. Before we cut you open, are you for or against the National Health Service? Well, it's a good question. What was the right answer? I mean, although these are surgeons, it wasn't the surgeons who were against it, because the surgeons mostly worked in the big hospitals, and they were all bankrupt. During the 1930s and 40s, this whole model of voluntary hospitals had really begun to collapse. The hospitals were quite happy to be taken over. The people who were not happy were the GPs, and they all threatened not to join. Actually, they all gave in and did join in the end. There were people who were very excited about the privatisation of the health service, but when I asked them what about Boots, I'm never quite sure what they really think. There's an organisation called Keep Our NHS Public, and they've produced some nice little postcards which they want people to sign to say, I do not want to be sent to any private services. I only want to go to NHS services, and they want you to give that to your GP, who is a private service. Your GP is self-employed, or employed by another doctor. He's not on the government's payroll directly. They're all self-employed. When you think back to your first encounter with healthcare, how many of you first remember something to do with a hospital? Could you wave a hand? Not very many. How about dentists? One or two people remember dentists? Opticians? GPs? GPs. Nursing? One or two nursing, but mostly GPs. 90% of the contact that people have with the health service is with GPs. And of course, quite a lot more contact it would be with chemists and opticians and people like that. The hospital service, although it gets all the political attention and swallows all the money, is actually not what most people experience most of the time. Better, all I'm saying is that for most of us, what we see of the health service, more than anything else, is some kind of private service. If we're against private service, we have to explain why we haven't been against it before. Do you think your GP is part of the National Health Service? Yes. Yes. Well, he has a contract. In the same way that somebody who provides a photocopier could have a contract. How about your dentist? Dentist part of the National Health Service?
No.
No? Well, they have a contract too.
And some of them do. Some just take private patients.
Yes. Well, some doctors only take private patients, but not very many.
But Martin, who's paying his salaries? Is it from income tax or is it from national insurance? Because their salaries are paid by us, aren't they?
The GPs don't have salaries.
Well, who pays them to earn a living? Where does that money
That
come
money
from?
comes from their contract with the National Health Service.
And the National Health Service is funded by whom?
By us.
So aren't we paying?
Yes.
Well, then,
Yes. But what I'm saying, but
National Health Service.
well, but people don't think their dentists are. Dentists are also paid in a slightly different way. They have a contract with the National Health Service which says you will do people's teeth and we will give you £80 and you'll run a little business. And on the side you'll employ people to do clean teeth whitening and all those other odds and ends. Opticians even more so. Opticians, you go to the optician, he tests your eyes, and that costs you 15 quid, I think, or something like that. Free for old people. I'm not quite old enough to get it free yet. And then, at the optician, they'll give you a little chitty, which will say things like left plus 16 and right minus 82 and things like that. Well, I've no idea what they mean, but they give it you. And in theory, you can go and take that to any optician anywhere in the world, and they will make you up a pair of glasses. So from the optician's point of view, they're very keen to have you come in and have your free eye test, because they can then sell you, well, in my case, they've sold me a pair of National Health Service glasses, which I think I paid about 60 quid for, and they say Oliver on the side. I don't know who Oliver is, but they would have been quite happy to sell me something much more expensive, which, as far as I can tell, would do much the same job. I don't know. Has any...
Designer frames.
Yes.
Designer frames.
So have you got designer frames? So I'd like to think a little bit about health as a business, because of course what happens in the opticians could be what happens at the doctors. I mean, it's the same way. You go to the doctor, who is privately employed, he gives you a little piece of paper with writing on, and you take that to the chemist, who is a private business, or maybe quite a big business. You know, is Boots part of the National Health Service? No? But the National Health Service wouldn't work without Boots, would it? And you get something back from the chemist. Do you trust the chemist to give you the right stuff?
Yes.
Do you trust the optician? Do you trust your dentist? Do you trust your GP? Who do you trust most out of them?
Dentist.
You trust your dentist? GP?
And optician.
The pharmacists,
You trust pharmacists?
because they sometimes make mistakes at the doctor's surgery,
Yeah.
prescriptions.
Yeah.
and the pharmacist picks it up.
Yeah, it's interesting because I've done this sort of talk to quite a lot of people, and I found that quite a lot of people don't really trust their dentist as much as they trust their doctor, and I'm not quite sure why that is, but I think it may be because at the dentist money changes hands.
And it causes pain.
And it causes pain, but then the doctor sometimes causes you pain.
So it's in their interest to do it.
Yeah. Well, yes, exactly. When I moved to Manchester, which is about 25 years ago now, I found that my new dentist didn't think much of the dentistry that had been performed by the previous dentist, and he drilled out all my fillings and put new ones in. Now, that was before I understood anything about the health service. Well, maybe they do. And now I think, well, that dentist was paid per filling. So it's in his interest to drill. But then I talked to a dentist. And this was quite interesting. Because he said, it's a bit like when an old lady turns up at the casualty department in the hospital and meets a doctor that they've never seen before. And they often admit you because they think, oh, this poor old dear looks a bit rough, we better put her in a bed and see what's the matter with her. And the dentist was telling me that actually, when you meet a new person and you look at their fillings, you don't know that those are perfectly adequate for this person, they've had them for 15 years. You think these are not as good as they ought to be, and you do it again. So, one of the issues in health, compared with almost any other sort of interaction you have, is that you've no idea, most of us, whether what you're getting is any good, or whether it's the right thing. You have to trust them. And I thought it was quite interesting that people trust their dentists less because of the money changing hands. What the government have recently done is give local doctors more control over the money. And I wonder if we will still be trusting our doctors so much when they start saying, no, you can't have your hernia repaired or your varicose veins or anything else that doctors don't think much of, because we can't afford it. Because up to now, although doctors have been pretty variable, at least most of us haven't, when the doctor says you need this thing doing, or alternatively, you do not need this doing, it's all right, don't worry about it. I think it's quite good that we can look at the doctor in the eye and think he's thinking about me, not about him. Because that is not the case in other places. If you look what happens in the USA, rich people get far too much treatment, and investigation doesn't do them much good. But they get sent for lots of treatment because the doctor gets paid more the more treatment they get. Poor people, of course, get less treatment than they need. Yes.
Can I give you an example? I lived in America, and just simple, really. $50. This is a few years ago now. I was a graduate student there. $50. I had to go and get this medication. I became allergic to something in Ohio. And every time I went just to have a prescription refilled, it was a permanent prescription, they said I had to go in and see the doctor and have my blood pressure taken, and I said, forget it. Forget it. Oh, you have to. Forget it. Forget it. I just need this. And it was for money. $50 was a lot of money. It's a lot of money today, but it was a lot of money 20 years ago. $50 US just to visit the doctor.
And maybe you did need your blood pressure taking, I don't know.
No, that's the automatic. You go in and the nurse is there to take your BP, and I say, I don't need my BP taking. That's automatic, because every treatment you have, they charge you. I broke my foot as well, and you have to show your insurance before you get any treatment, or you get shipped to the hospital that will take you. For me?
Are they not charging a lot of the time for people's insurance, so they're not really bothered?
Yeah, but we won't go into that, but 50 million Americans have no insurance.
Thank you.
The bit I never asked you is your last encounter with the National Health Service. Most of you should remember 1974. There was a huge reorganisation of local government, which is when we got, that's when they set up the Greater Manchester Council, wasn't it? And at the same time, the bits of the health service that had been run by the local council were shifted into the NHS. So all the midwives, clinics, public health and stuff came into the NHS. And so there was no longer anything directly controlled by local politicians. The health service was run by, well, management committees of various kinds. People were appointed essentially by the government. I've got a nice letter in the Socialist Health Association files from one of our members who was appointed to the board of one of the London teaching hospitals. She was a nurse in about 1949, and she said, "I'm the only person on the board who hasn't got a title." Because running those big hospitals was the sort of thing that the wives and families of the nobility did. You know, it was good works. And that, you know, I'm not complaining about them, but they were not democratic in any local sense at all. And that became even more so in 1974. And the government then set up community health councils, which was supposed to be the voice of the local population. And I was a member of one, and I could go on about that at some length on another day. That was the first reorganisation. I want to take you now to Mrs. Thatcher. Fine woman, I understand. And she didn't do very much for the health service for the first part of her government. Can I get back, Bernard? Yeah, just. In 1990, well, first she introduced managers. Before 1982, there were no proper managers in the health service. Everything was run by committees of doctors. And there was a secretary to the management committee who was the nearest thing to a manager, but there was no real management. Mrs. Thatcher introduced what was then called the internal market. And hospitals and health service organisations, not the GPs, but the other things, were turned into trusts. And the idea was to make them more like companies. And companies typically have a board of directors, and so they introduced boards to these trusts. And this is not an official document. This is this is produced by some anarchists about 1990. I've got lots of interesting stuff about health service in our file, and saying we have no intention of privatising the health service. But the most efficient method of organisation is the market. And the idea was that money, that the people who decided what was to be provided should be separated from the people who actually provided the services. And I don't know what you think about that idea, but it's... and the anarchists said the trust managers will run hospitals like businesses. They would cut staff costs, spend on advertising. Well, actually, they never spend any money on advertising. Pay themselves preposterous salaries. Well, there was a bit of that. And take golden handshakes when their hospitals go bust. And the anarchists say health services should be for needs, not for profits. And that sounds good too, doesn't it? But if you're going to have a super-duper whizzy scanner thing that Bernard mentioned, somebody has to pay for it somehow, don't they? Mrs. Bottomley, according to the anarchists, said those who actually provide the services should work for love and leave the bit money to those whose business is money. People get very cross about the idea that people should make a profit out of your illness. But they do, don't they? Your dentist, your optician, the doctor, the people who make the drugs and the machines, they all fundamentally make a profit out of your illness. And I can't see, unless we abolish capitalism completely, which of course some of my friends would like to do, I can't see how you could not run the system on the basis that people make a profit out of your illness. The trick really is to try and line up their interests with my interests. One of the things that it said on the leaflet in 1948 that Bernard showed you was that we will provide everything for you. But what you got wasn't much. This is a graph, this is 1950, and the wiggly line is the change in amount of money in the health service year by year. But more interesting actually is the thicker line, which is the average expenditure as a percentage of gross domestic product. In 1950 it was down to about 1%. And the gross domestic product, that is all the economic activity in the country, wasn't very much. This goes up to 2007, when it's up to 7.5%, and it's gone up a bit since then. The Labour government deliberately spent more money on the health service, so we're now spending, I think, about 8 or 9% of GDP on health care, which is still only about half of what they spend in America. But our life expectancy is a lot better than theirs. They spend more than any other country, and their life expectancy is, I think, 36th in the world, or something like that. And every country now is having battles about whether they can afford to carry on paying for healthcare for everybody. Because healthcare gets more and more expensive. We can do more for people. We can keep people alive. And there's no obvious limit in how much you could spend or how long you could be kept alive. Life expectancy in this country has been going up about 1 year in every 4 years, steadily since 1840. And it's still going up about 1 year in every 4 years. So we've been here about 2 hours, so your life expectancy has gone up by about half an hour. I think that's probably as good a place to stop as any, because I could go on at considerable length, but I have some lovely merchandise for you. I've got a copy of Nye Bevan's book, In Place of Fear, which is the best thing I've ever read about the principles of the National Health Service. Yours for only £2.
Thank you.